All right, we are live. Good afternoon. Today marks the completion of 5 incubation cycles or 10 weeks since we identified the first COVID-19 case in Pitt County. Unfortunately, it also is the day that we dreaded would come for some time, the day when one of our own healthcare workers would test positive for COVID-19. Last Friday, May 22nd, 2020, one of our healthcare providers chose to be tested for COVID-19. This individual had no symptoms and did not inform Pitt County Health Department that a test had been done. This morning, we were advised that the individual's test had returned positive. The individual last worked at Pitt County Health Department on May 26th, 2020, Tuesday this week. Out of an abundance of caution, all clinic staff exposed to this individual have been sent home and will self-quarantine. All staff will be tested 6 days post-exposure. Return to work decisions will be made after the testing results have been received. All patients seen by this provider will be contacted directly by Pitt County Health Department and will be offered testing. This testing will also be offered at 6 days post-exposure. With our clinical staff in quarantine, we have had to suspend clinical operations as detailed in our written press release from earlier today. WIC and other Pitt County Health Department services will continue to operate as normal. While we have taken steps to protect our staff and patients from COVID-19, viruses are a devilish thing, and COVID-19 found a gap in our defenses. Once we are able to clear our employees in quarantine and return them to work, we will resume clinic operations. No matter what, we will improvise, adapt, and overcome these challenges until we get to the other side of this pandemic. Thank you. Happy to take your questions.
Dr. Silvernail, you said that this employee opted to be tested. Where were they tested at? So they weren't tested at the health department?
They were not.
Can you say where they were?
They were tested at the Walmart site.
Do you know why they decided to get tested?
They're a healthcare provider and felt they should just be tested for general principles. They were not sick in any way.
When did the healthcare provider find out they had tested positive?
This morning.
Morning Thursday. Do y'all have an estimate of how many other employees have come in contact with this individual and how many patients had come in contact with the individual?
There are about 10 staff members who had contact with this individual and about 10 patients who were seen by this individual.
And you said this individual had last worked on Tuesday. Mm-hmm. Was the reason they were off yesterday? Was it just because it was their regular day off, or were they not feeling well?
They're a part-time employee. This individual only works Tuesdays at the health department.
Can you say what area of care they provide?
She's a healthcare provider.
Like, as a healthcare, is this person a nurse that works?
She works in our clinic. She's a healthcare provider. That's as much as I can say.
Okay. Oh, right again. Employees, how many we're testing, and okay, that was all my questions. Thank you, sir.
Okay.
Hello. I just have a couple questions. How long before in-person visits can be conducted? Is it when all of those 10 or so employees have tested negative, or is it when they start, sporadically testing negative? Or?
Well, we will test them all at 6 days. Our testing will be run at the State Health Department laboratory, or State Lab of Public Health. We anticipate 2 to 3 days to get results from those individuals. At that time, we'll make a return to work decision on those individuals. As soon as we can get adequate staffing to run our clinic, we will reopen the clinic and run our clinic. We're going to continue to provide some telehealth services We have some folks that have some scheduled minor things for PPD checks, tuberculosis test checks. Those sorts of things. Our non-exposed nurses are going to continue to see those couple of things, but the bulk of our clinical services had to be suspended for staffing reasons.
Okay. And if someone was planning to do a walk-in at the health department and they, obviously cannot right now, what do you suggest they do in the meantime?
Well, I hate to send anybody to the emergency department, but the emergency department is available. If someone needs care urgently, we will try to be up and running for those services that are suspended as soon as possible. Our WIC services and other services remain in operation. So folks who come in for WIC services can walk in and do their WIC. Much of that is still being done remotely, but if they need to come to the health department for WIC, they can.
Okay. And my last question, what can you say to some of these residents who maybe have some fears right now after finding out that their provider tested positive? What can you say to kind of ease some of those fears?
Well, as far as we know, the provider was wearing a mask in clinic. I think the risk to my staff and to the patients that were served that day is very low. And we will offer testing to them. And, unfortunately, as this continues to circulate in our community, we will likely see more of this where people inadvertently expose others. Okay, so my deputy director tells me that instead of 10 people, it was 4 people who actually had contact with the provider. So.
And that's patients, right?
Patients, yes.
Patients.
Yes. Staff numbers unchanged.
So you're waiting 6 days because that's how long it takes for the virus to become apparent in somebody?
That's the recommendation to do post-exposure testing now. If you test too soon, you can get a false negative.
Yeah.
So the virus needs some time to incubate in an individual before you can detect it. So the recommendation from our state Department of Health and Human Services to wait 6 days.
Okay. And so once they're tested at 6 days, and if it comes back negative, is there any risk that it could show up later?
Very, very unlikely
Okay.
at that point. Most people, the most common time to develop illness after exposure is 1 to 3 days.
Mm-hmm.
Most people have presented by 5 days. Almost everybody presents by 6 or 7 days. And it's a very, very rare person that is in that day 7 to 14 window to develop symptoms. So if we test them at day 6 and it takes 2 to 3 days to get test results back, they'll actually be at day 8 or 9 post-exposure when we get results back. And if they're still asymptomatic, then that's a pretty good indicator that they're not infected.
Could you help to just remind everybody, if a person is asymptomatic, are they still able to pass the virus on?
They are probably less efficient at spreading the virus if they have no symptoms, but it is still possible for them to spread the virus.
So are you pleased that this individual made this decision to be tested then?
Sure. We would have preferred that we had known she'd been tested. And in general, we would keep somebody out of work until we know their test results, even if they're asymptomatic. But I'm not going to beat this person up. The odds were that the test was going to be negative. So.
Did this person explain why they felt like they needed to be tested? Had they come in contact with someone they knew? Not
that we're aware of. It was just, well, I can get this done. I'm a healthcare provider. I want to know.
Is the county, are you going to, because I know there is a cost involved, are y'all going to start testing all employees that are healthcare providers?
We test healthcare providers as we need to. So most of our healthcare offices, if they have suspicions, have done their own testing. But we have assisted some healthcare facilities with testing when they've requested that.
But as far as like Pitt County Health Department, will you start doing department-wide testing now?
No, not at this time, Ginger. No,
Okay.
If there are other cases identified, we may do more, layers of the onion, so to speak. But we think this is a low risk exposure to our employees, but again, as I said, out of an abundance of caution, we felt it was best to send everyone home and then to test them at the appropriate interval.
Does this individual have any idea how she might have come in contact with COVID-19, or is this one of those instances where you can't trace it, or have y'all not had enough time to do tracing?
Well, by definition, an asymptomatic person,
Mhm.
you know, she would not know when she was exposed. She did not say that she was tested because she was exposed. She was tested just more out of curiosity, I guess.
I hope she continues to feel well.
I do too.
I believe Ariana Kraft is on the phone. Are you still there?
Yes, I am. No further questions. I think he covered everything.
Okay.
Okay.
I'm good.
You're good? You're good, Ginger?
Awesome.
All right. Thank you all.
Thank you.